I think many of you in this room already know about the increasing incidence or new cases of HIV infection in young Latino sexual minority men, particularly those who are between the ages of 18 and 24. That is the ultimate goal of our project, is how can we be a part in helping reduce HIV incidence. We believe that a major factor that is influencing the low rates of HIV testing and PrEP uptake in this population is their experiences of intersectional stigma, meaning because of their multiple layers of stigmatized identities, for example, identifying as a sexual minority, identifying as a Latino, or identifying as an immigrant or a non-citizen, identifying and also including the stigma attached to HIV. All of these kind of intersect, and we believe that the intersection of all these characteristics and the disease or the health issue that we're focusing is responsible for or contributing quite a bit to low rates of HIV testing and PrEP uptake. And so in order for us to substantially or reduce, at least we believe, HIV incidence in this population, we first have to understand the experiences of this population in terms of what does intersectional stigma, or what do multiple layers of stigma look, kind of explore their lived experiences, learn from their lived experiences, and use those lessons to develop a resilience-focused stigma reduction intervention. And this is where our approach, our use of positive deviance comes in, because for as many of you in the room may know, when we talk about HIV prevention, when we talk about gay men's health, when we talk about HIV, more often than not, there's a focus on the risk factors. There's focus on deficiency. Those approaches to health behavior we recognize that they're also an important part of health behavior change, but we also want to emphasize that within this community, there are assets, there are resources that we can harness, that we can leverage in order to promote health behavior change, in this case, to reduce HIV infection in this community. And this positive deviance approach is an approach that prioritizes this focus on strengths and assets, because it recognizes that within this community, right, within the community of young Latino sexual minority men, there are individuals or groups within this community who have succeeded in achieving a desired outcome despite facing similar or worse challenges and constraints compared to others in the community. So we wanted to discover, identify these solutions that already exist within the community itself, and hopefully we can harness it and we can expand it into an intervention that can benefit not only certain individuals or groups within the community, but hopefully the larger community. I'll be brief in terms of what are we doing right now, like how are we actually putting this positive deviance approach in action. So the first step, which we finished, included identifying recruiting eligible youth, so 18 to 24, self-identify as gay, bisexual, or use other terminology to refer to men who are attracted with other men. After we've done focus groups and individual interviews with them to learn about their lived experiences of intersectional stigma, particularly how they're coping or how they're managing, how they're dealing with their daily and major experiences of discrimination, we use what we learned from step one, and then created what we are calling short stories or vignettes. These are short videos that we created of hypothetical youth, hypothetical scenarios based on what the youth in step one told us. This is where we are currently with our project, in which we are presenting these short stories to a different set of young Latino men. We want to elicit, or we want to obtain information from this new group of youth to tell us what they would do if they were in the same situation as the hypothetical character, and what kind of support, what kind of programs may be beneficial for them, and how can we actually implement these particular solutions. We are, as I mentioned, we are doing step three right now. After we've learned or finished step two, we are going to move to step three, which is this is when we will integrate the feedback that we got from youth who participated in step one and step two, and then bring it to our youth advisory members and key informants, i.e. practitioners who have been working with this population. Our goal is to present to them a framework, right, of this is an intervention that young people believe would be helpful, would be attractive, an intervention or program that they will participate. We present it to the youth advisory board members and the practitioners and ask them about, can you speak a little bit more about the feasibility, the acceptability, and cultural relevance or appropriateness of these different interventions, of this particular program, and how do you think this may align with some of the existing programs or services that you may have. I'm going to skip through this. How did we identify positive deviance youth? But if you have questions, I think we feel free to post that in the chat, or we can do it during the Q&A. For this particular study, for the positive deviant youth, we use data from 15 young men who we interviewed after they were identified from the focus group. So there were 26 youth originally. Out of those 26 youth, we actually we selected 13, I believe, who fit the criteria of what is a positive deviant youth. And then we have 2 other youth who were referred to us by the community. So from those 15 youth, these are the findings. These are what they told us in terms of the challenges, their coping strategies, and how can we utilize their characteristics, their strategies to improve HIV testing and PrEP uptake in this population. For many of you, this may not be surprising. There are multiple levels, multiple layers of stigma that the young people experienced, the young people in our sample, including the sexual stigma attached to being a sexual minority. There's also racial ethnic bias, there's immigration bias, and there's also stigma associated with their socioeconomic position. And again, as many of you know, not only from our research, but evidence exist linking all these different types of stigma to many of these adverse health outcomes you're seeing on the right side of the slide. Many of these you're very familiar, including depression, substance use disorder, sexual risk-taking. We've also noticed that many of the youth mention about desensitization or fatalism as an outcome of experiencing this multiple levels of stigma. Just quickly, I wanted to just show to you all, based on the survey responses that we got from the phase 1 participants, just an illustration of the proportion of youth who said that they experience certain types of day-to-day discrimination, and also major discrimination because of who they are, including 42% who mentioned that they had been repeatedly harassed, and 36% of them who mentioned that they had been sexually harassed. Moving on to who are the positive deviant youth, because this is what we would like to really illustrate, is that despite the challenges, despite the inaction from all levels of government and decision makers to address this issue, there is a certain subgroup of young Latino sexual minority men who exhibited resiliency and who exhibited positive characteristics that we hope we can leverage and use to create an intervention. So broadly, the positive deviant youth in our sample, in our study, include those youth who have a strong sense of who they are, meaning in terms of being able to talk about their sexual orientation and their gender expression. There are different degrees of outness in our sample, but even those who may not be what we would call completely out, they remain comfortable discussing about their orientation, their gender expression, including level of comfort in discussing different sexual health and sexual behaviors affecting young Latino sexual minority men. The second major characteristic of positive deviant youth is that they are socially engaged. And we notice this through their participation in various LGBTQ plus activities, particularly activities sponsored by Hola Latino at El Centro. Many of them, their engagement in the community have allowed them to also be peer mentors to other young Latino sexual minority men. Another characteristic of the positive deviant youth in this sample is that they tend to have high level of acculturation. And by acculturation, we mean that not only do they have more support, more supportive family, more friends, but also equally important is that they have greater knowledge of how the healthcare system in the United States would typically works. And that allows them to also be more knowledgeable about their rights and responsibilities, and also knowledgeable about different HIV prevention methods, including PrEP. Okay, I have one more slide to go. So having learned what are the characteristics of the positive deviant youth in our sample, now we want to learn from all these characteristics and turn them into factors or modifiable factors that we can actually use in an intervention. And so according to the youth in our study, they have exercised 3 different levels of resilience behaviors or practices. So not surprisingly, there is the individual level resilience, and that individual level resilience is characterized by this strong sense of who they are, not only in terms of their self-esteem, their self-confidence, and their self-efficacy, but more importantly, their ability to believe that they, not necessarily that they have a future, but they can see different version of themselves in the future. And the more positive, the more desirable version of themselves are serving as goal for them to overcome many of the day-to-day stigma experiences and discrimination. There's also a family level component to this resilience strategy, and that is having a supportive family, We also recognize that for some youth, they may not have their family with them here in the United States, or they may not have a supportive family. But for young people, for all the young people that we spoke or we who participated in this study, they all acknowledge the importance of family. That is central to having a positive mental health and also being able to act on desirable health behaviors. Lastly, and also a big component of the resiliency that the young men showed or exhibited is the community level resilience. And this community level resilience refers to the social connectedness within the community. And as I mentioned earlier, this has been facilitated by the Hola Latino program of El Centro. And this social connectedness um, helps or contributes to creating this sense of belonging among this youth, that they can access support, emotional support, instrumental support from this group. And so all of these three components we're hoping to inform what this intervention may look like. And we're still kind of like in early stages of developing what this intervention may look like, but we have some ideas based on the positive deviance approach. I can share with you later some of the vignettes if you're interested, but I want to be mindful of my time. So I'll go to my last slide and just emphasizing, in addition to the community engaged work, in addition to wanting to achieve our goal of reducing HIV incidence in this population, we wanted to highlight that there are assets, existing assets and strengths in this community that may not be common or that may not have been used to leverage and for other youth to also use them in order to prevent new cases of HIV in this population. Secondly, we want to recognize that this is not our stories. These are not solely our knowledge, that this is the knowledge entrusted to us by by our study sample, particularly the young Latino sexual minority men in North Carolina. And we want to recognize that they can also participate in creating knowledge and actions to reduce stigma and its adverse effect on HIV prevention. That through this positive deviance approach, we wanted to amplify and recognize their lived experiences and their assets, and hoping that it will contribute, their knowledge will contribute to creating solutions that are created by them and that are meaningful to them. Because it's not, I think our belief is that we just don't want to see them as participants in our research, respondents in our research study, but as throughout the study, we also want them to participate in creating the intervention that will, for many young people, would be meaningful and would be attractive. So I'll stop there. One last thing, just the acknowledging our funder and our colleagues at El Centro Hispano and our youth advisory board members for being patient with us as we go through the project. So thank you so much.